Hey guys, welcome to my knee pain seminar. I'm Christine Sweezy. I'm a doctor of physical therapy. I'm a strength and conditioning coach, and I'm an exercise physiologist. So just a little bit about me. So I just graduated PT school last May. And as I was going through PT school, I just noticed that there was a gap between strength and conditioning, like playing sports growing up, always in the weight room, and then going to physical therapy. And it was pretty low level, just getting people out of pain. And I feel like there's a disconnect between, when you're out of pain and when you're ready to go back to sport or in the gym or doing whatever you want to do. So my niche is kind of bridging that gap and returning people back to sport. So hopefully this is helpful for you guys. And if you have any questions, go ahead and drop them in the comments and then I'll try to answer them throughout. All right. So just to give you guys an overview, I'm just going to go over some common types of knee pain, common misconceptions that we hear a lot, different pain contributors, some management and tips if you do have pain, and then how to train if you also have knee pain. All right, so there's a few different types of knee pain, patellar tendonitis or tendinopathy, aka runner's knee, jumper's knee, anterior knee pain, just like right under that kneecap. Patellofemoral pain syndrome. There is a lot of names for it, but it's all like that pain right underneath that knee there. I'm going to go over that. We're going to go over osteoarthritis for a little bit older folks. And then we're going to go over lateral tracking or just feeling instability in that knee there. So patellar tendonitis, like I said, is that pain like right underneath that kneecap there. And so what's cool about this is that the tendons are inflamed, but tendons respond great to load. So if you ever go to the doctor and they tell you just rest and then you feel better, and then whenever you go back to the gym and it starts hurting again, it's because you haven't really done anything to change the capacity of that tendon to be able to handle load. So it's no wonder that you feel better because you're not doing anything, and then when you go back to what you're doing before to hurt it, it hurts again. So if you have a knee pain that sounds like this, what you want to do is just deload stuff. So you don't have to work out completely, but whatever like exercise that you're doing, just ramp it down a little bit. So we want to calm things down. We want to put that fire out so it's not inflamed, it's not aggravated. And then we're slowly going to reload those tissues to be able to handle that. And then that'll give us some better tendons, some healthier tendons. And then how we reload that is the most important part. So if we do it too fast, obviously we're going to injure that tendon again. So it's a slow process, but just gradual exposure to that load is going to be good for that tendon. So a couple things that I like to do with this, I wish I had a chair. It's fine. Pretend that I had a chair. And we're going to go down on, let's say my left knee was painful. I would go down, sit on the chair, and then stand up with two. Oh, thanks, Chris, coming in with the chair. So sweet. All right, so perfect example, eccentrics. We want to work that slow all the way down, and then we're going to stand up with two. So slow on the way down. And then on the way down, I want to make sure that my knee is tracking in line with my toes. So I really don't want that to go in or out. Everything all nice in line. Going down, standing up with two. And then as that starts to feel better, then you can progress to standing up, but that's a good place to start, going down with two and then up with one. And then isometric, so either doing wall sits or, let's see if I can scoot this a little bit closer. So same thing, I'll go right knee this time. If I kick my knee or my foot into a box or wall or anything, so I'm generating tension in that quad and I'm getting muscle activation, but it's not like my foot is going back and forth. So isometrics have a really good analgesic response, so that's really good for decreasing pain. So that's another good place to start for knee pain if you have that in the front of the knee. Also, different things to consider for decreasing pain is just decreasing that range of motion in your squat or lunges or whatever. And then you can also decrease the amount of reps that you're doing, and you can do it slower. So the amount of time under tension that muscle is under is really good for hypertrophy, which is muscle growth. So you get a lot of good benefits from that. For knee osteoarthritis, this is for a little bit older folks. So if you suspect knee OA, if you're over 50, if you have some stiffness when you wake up in the morning, but then once you get moving around in less than like 30 minutes, you feel okay. Maybe you have some like cracking, popping, we call that crepitus. If you just have some tenderness around that bony joint, if you have a bony enlargement, so maybe your knee is actually physically bigger, and if you don't have any warmth around that knee, we're thinking OA. And then these are lateral tracking. Those are the people that feel like their knees are kind of unstable, or they feel like they're going to dislocate or just give out, or maybe they've like dislocated their knee a lot and they just feel unstable. So if you like move their kneecap, it moves a lot. So what we want to do with these people is a lot of strengthening, and we're going to strengthen the quads, the hamstrings, the calves, everything around that knee to help give stability to that knee. Okay, so we're going to go over some common misconceptions that I hear a lot. So one, squatting below parallel is bad for your knees. It is not bad for your knees. Reality is squatting can actually make your joints stronger and more resilient. So if someone did have knee pain, then I do want to look at the depth of their squatting. And if they do have pain lower in their squats, then I just want to keep them out of that painful range, keep them in a range that is pain-free, and then they'll slowly be able to go a little bit further. So depending on what your starting pain is how we're going to progress that squat depth. But every time that we go downstairs, oh, no, sorry, that's the next one. But squatting below parallel, totally okay. Number two, never letting your knees pass your toes. So guys, in reality, every time that we go downstairs, our knees pass over our toes. So it makes sense that we want to be strong in the different positions that we're put in throughout the day. So when we're squatting, let's see. And then I obviously don't want our knees to go forward. I don't want those heels like coming up. And I'll go over this later when we go over different exercises and like training. It's a good cue to keep the weight in your heels as you go down. But my knees are naturally going to go forward. And if they go past my toes, that's okay if my weight is in my heels and my hips are going back. So don't let someone tell you like, oh, don't let your knees pass your toes, because it is okay. And so I put a picture of an Olympic weightlifter up here. And this next slide, I have a study that just says it's looking at cartilage thickness, which is in between your knees, and adaptations for this population. And when they looked at powerlifters, their cartilage was actually thicker after powerlifting. And if you think about what they do, they're catching their weight all the way at the bottom of their squat. So our body's pretty resilient. It can handle all the different types of load that we put on it if we're progressed appropriately. Another common misconception, which is great because April is the 100-mile run month. So running is bad for my knees. I hear that all the time. And a pretty common denominator I hear with these people is they go from nothing and they're not running, and then they start to ramp up and they get on a training plan that was too much too soon, and that's when a lot of injuries can happen. So this was a study that just looked at marathon runners, and they took MRIs of a bunch of different people who were asymptomatic, meaning they didn't have any pain, and like 36% of them had meniscal tears, 65% of them had cartilage damage, 52% of them had effusion, which is like swelling in their joint. So all these people have all these different conditions, but just because they have these doesn't exactly mean that you're going to have pain, because a lot of things that show up on imaging and pain are pretty poorly correlated. So these people ran the marathon, and then the findings that they found is that there weren't any like increase in injuries or worse things like on their MRI findings. So that's good. Keep on running. Okay, another common misconception I hear a lot is I have pain because I'm bone on bone. And so like I said earlier, there's a poor correlation between findings on MRI and imaging, X-ray, and pain. So some people can be bone on bone, but then not even know it if they didn't have an X-ray because they're out living their lives. They don't have any pain. And then there's people that have their full meniscus intact and a whole bunch of cartilage, and they have pain for different reasons. So don't let your imaging kind of define your pain. Okay, so, and then another thing I want to talk about imaging is that, so imaging doesn't show the amount of pain that you're feeling. It's kind of like when we take a picture of someone, it just shows like what's on the outside, but it doesn't show like how we're feeling. So same with like the MRI imaging, it doesn't show the amount of pain you feel. It doesn't show future pain levels. So don't let your doctor tell you, oh, this is the worst set of knees I've ever seen. You're going to need a knee replacement in 2 years or whatever. Cause your MRI imaging like won't be able to tell you that. And then it doesn't show your ability to do your daily activities throughout the day. So what it does show is normal age-related changes. So think about this like wrinkles on the inside. So as we age, it's pretty common to get tears, degenerative wear and tear. But just because we have that doesn't always mean that it's painful. So people have this stuff and they don't have pain, so you can't necessarily put 2 and 2 together. And then the findings will also show things that were probably there before you had pain and things that will still be there once your pain is gone. So it's important to remember that findings can be relevant to your injury, but it's important to know that these findings usually won't change your course of rehab or your course of treatment. And then for anyone that's trying to lose weight out there, this can have a great effect on your knees because every pound lost takes 4 pounds of pressure off your knees. So just think about that when you're losing weight. And if you do have knee pain, shedding some of those pounds will definitely help what you're feeling in the knee. Okay. And so there's a couple of different ways of treatment that we can go about this that I want to talk as a physical therapist. So we have passive treatments like massage, soft tissue work, dry needling. I actually just needled a couple people before this. Manual therapy, taping, all these things feel good. So if we think about our pain threshold as a cup, we have different daily stressors that contribute, like pouring water into the cup. And then, so once we reach that brim of the cup, like we start to like overflow, like stuff was crazy at work, this pandemic, like all of the stuff's kind of hitting the fan, then you can start to feel pain. So all that passive treatment that's getting done to you can help pour water out of the cup to make you feel better. And then there's active treatments that help build the cup. So if you are able to handle more things in your cup, more load or more stress or whatever it is, you'll be able to do a lot more. So these are the kind of treatments that that'll help a lot more than just like the passive treatments. Okay, so like I said, pain can be turned up by stress, anxiety, depression, avoiding activity, getting decreased quality of sleep. That's huge. Or just relying on passive treatments. And then pain can be turned down by exercising regularly, reducing stress, eating and sleeping well, socializing with people, but like keep your distance, and partnering with a good clinician. Okay, so let's talk about pain and let's talk about exercise. So how much is too much? So is it okay to exercise when you're injured? Yes. And so the things to consider here, there's a lot of things to consider, right? So we can think about the weight that we're picking up, how many reps we're doing, how many sets, the range of motion, how deep are we going in our squats, in our lunges? Are we going to pain? Are we going through pain? The more that we do an exercise, is the pain getting worse? Is it getting better? Is it staying the same? How intense are you doing an exercise? Are you doing something at 60%? That's a good way that I'll modify people going back if they're slowly improving, but they're not ready to go balls to the wall, because that's when a lot of re-injuries can happen. But I'll be like, hey, I want you to go. I want you to do this workout. Just give me 70% intensity. And if they're able to handle that, then I'll bump them up the next week to 80 or 85. And that's just another way that they can progress. time under tension. So if we're doing tempo squats, are they able to handle that eccentric part going down slowly for 3 seconds, 5 seconds, whatever. And then we can look at quad versus hip dominant exercises, which I'll go over in the next slide. Okay, so this is like, it's kind of hard to see, but I will actually demonstrate some of these. That box is heavier than I was thinking about. Okay, so I'm gonna go through different squats and deadlifts. So hip dominant exercises. So if we're having knee pain, I'll typically work up the chain. I'll look up the chain and below the chain. So if people have knee pain when their knees are going forward, then I'm gonna send the hips backwards so that the knees aren't traveling so much forward, because I know that that's something that aggravates them. So here's like different exercises that we can start to manipulate to slowly get them back into what they want to do. So so if we had a barbell on our back, right, and we're going to do a hip dominant low bar back squat, my back is going to go forward a lot. My knees actually aren't going too far forward, so this will be a good place to start someone that has pain. And then if I wanted to sit that barbell a little bit higher on my back, my knees are going to go a little bit more forward. Same thing if I flip the barbell on my shoulders, then my trunk position is going to be a little bit more upright, and my knees are actually going to travel a little bit more forward. And then if I was throwing the barbell over my head, then my knees are going way forward and they're going to be over my toes. So that was just a nice progression of different squats and how forward my knee is going throughout those. And then if I was training deadlifts, so I'd start with just like a normal Romanian deadlift, going down, keeping the knees soft. They're not really traveling forward, but I'm getting a lot of good posterior chain activation and strength going down this way. And then if I wanted to go down to a conventional, so I'm picking the bar up from the bottom, then my knees are going to bend a little bit more to reach down to that bar. Let's see, if you ever seen the hex bar deadlifts, those are set up so that you start a little bit lower, so your knees are a little bit more bent. And a sumo deadlift, you're getting pretty low to the ground, so you're getting a good amount of knees coming forward. So there's a whole continuum just of doing squats and deadlifts that you can play around with. And I'm sure out of all those variations, you'd be able to find something that works for someone and then be able to progress them back to regular squats or deadlifts or whatever they wanted to do. So another thing I wanted to point out is the similarities between rehab and training. So we're both doing progressive overload, right? We both want to increase our weights. There's going to be specific adaptations to what we're training for, both in rehab and training. We both want to increase strength. We want to increase resilience of the muscles, joints, tendons, whatever it is. Just like rehab is on the lower end of that scale and training is on the higher end. But it's still the same principles. We still want to do the same things. So rehab is just kind of training while you're injured. Okay, so then going through different exercises, here's like, I'll just go through some exercises that I go through when my patients have knee pain and what I think everyone should be doing if they have knee pain. So everyone should be squatting, everyone should be deadlifting. I'll just go over some quick cues for, I'd say like a normal squat. Okay, so I get questions a lot about feet placement, and I'd say whatever feels comfortable for you, because everyone's foot anatomy is different, everyone's hip anatomy is different, everyone stands differently, so no one's gonna squat the same. So if your toes are pointed forward or they're a little bit out, 45, my toes are slightly pointed out, and then my feet, for me, and what's comfortable is a little bit wider than hip width apart. Some people like it a little bit wider, some people can squat narrow. If I squat narrow with my toes facing forward, then I get a little bit pinching in my hips. It's not comfortable for me, but if I open up just a little bit, then I can drop down easy, no problem. So start to just like play around with what feels good for you. And then for deadlifts, I'm actually gonna go feet right underneath those hips, and then we're gonna hinge forward. So it's probably better to see this from the side. So I'm gonna hinge forward, keeping this back straight. and hips are going backwards. So like if I had a bunch of groceries in my hand and wanted to close the car door behind me, I'm just gonna bump that backwards. So that's a good cue for the squats. And try not to squat your deadlifts. Those are two different exercises and they work two different things. So don't squat down to do your deadlifts. Okay, lunges. I feel like reverse lunges are a good place to start. You can play around with your depth and how low you're going, and you can work down to 90 degrees, obviously going down all the way. But lunges, that's a good way to work single leg strength, and then you can tell if my left knee was having problems, how it compared to my other leg. So that's a good way to try to get this one back to your normal strength. Glute bridges, I think you guys like do this a lot in class, but I'll just go ahead and show you. So I'm gonna lay down on the ground and feet are about hip width apart. I'm gonna make sure that my low back is on the ground. I'm gonna squeeze the glutes and then I'm gonna lift my hips up. And so I'm gonna try to have a straight line from my shoulders to my knees and then go back down. And if you have a band, you can actually put that around your thighs for increased hip activation and going up like that. So building glute strength is really good for that. Let's see what else I have. Oh, clam shells. Okay, so clam shells are great. This is one of the more important exercises that I give for all my knee pain patients. So I'm gonna set up my shoulders, hips, knees, and ankles are stacked. My legs are about 45 degrees. If this is 0 and this is 90, I'm going right in the middle. My ankles are gonna stay together, and then I'm just gonna lift up this top leg and then bring it back down. So you should feel most of that in that side of your hip there. And a common fault that I see is people love to roll back and get their trunk in there because it makes it easy. Don't let your trunk roll backwards and only lift up with that hip. I also have some side lying leg lifts in here. So this is also gonna work the side of the hip. And cues that I'll give is to turn the toe down and then we're gonna kick slightly backwards to really get that side glute in. So a lot of times I'll see people just coming up here. That's really gonna activate like a smaller muscle in the front of your hip called your TFL, which is overactive anyways. So turn that toe down, we'll take that little muscle out, going backwards, you should really feel it. And then hip cars. So this one we're gonna start on all fours, and this is pretty tough. So we're just going to kick back as far as you can go, and then we're gonna open up and then come back down to where you started, and then we're just gonna retrace that position and back down. So that was one. So what we're doing is training our strength at that end range of our hip joint, which we're never out here throughout the day. So those are pretty tough, but working hip stability is huge. Like I said, working up the chain, because the knee is kind of the unfortunate joint that gets caught in the middle between hip issues or foot issues. A lot of times it can be traced back up to the hips. So if you clear the hips up, a lot of time that knee pain will clear up too. Okay, and then here's a slide that I love to show my patients. So on one axis, it shows their progress. On the other side, or other axis, it shows the amount of time that's passed by. So everyone expects that their rehab is going to be linear and everything's going to be great and they're going to have less pain than the day before and they're never going to have a bad day. When in reality, it's all squiggles and they're going to have good days and they're going to have bad days and they're going to go backwards and they're going to shoot up. But as long as that needle is moving in the right direction and it's moving forward, that's what we're looking for. So if you can not only just increase your weight from week to week, but if you're less tired after you do the same amount of reps, or you can do more reps or whatever, all these different things are good indications of progress. Okay, so I'm just going to go ahead and wrap up. So if there's any questions, I don't know if anyone dropped any questions. Oh, I think someone else gave me some questions earlier, I'll hit. But main like takeaways from today is just know there's a lot of different types of knee pain with a variety of causes. So I want you guys to find the exercises that feel good and keep on doing those exercises until they get easy, and then progress them. And then progress those to deeper ranges, more knee forward positions. That tendons, they don't need rest, they need load. So don't let your doctor just tell you, oh, like rest and then go back in like a couple weeks. And then just like motion is lotion for your joints. So keep on moving. Okay, so I see the question, can you recap exercises to deal with pain up and down the stairs? Okay, yep. So if we want to go back to those beginning exercises, so I know a lot of people will have more pain going down the stairs than up the stairs. Okay, and that's because when we go down the stairs, that knee is going over our toes, which can be an aggravating position if you're not used to that, or if your knee is just a little more aggravated to start with. So here's where we're gonna do that one leg going down. So you can either kick this leg out, or you can like kickstand it if you need balance. Slowly going down. And the more that you can control that descent going down, stand up with two. So this other leg is gonna help that pushing up position. So you can slowly like work down. You can work down to lower heights. You can start at a higher height if your knee is a little bit more aggravated, but just playing around with tempo and height and try to get that down, standing up with two. And if that feels okay, then next week, go ahead and progress, like going down with one, and then you can try standing up with one. So that's a good one. And then if you want to bring a chair up to the wall, so you're seated, this is my wall, and then you're just going to kick into the wall as hard as you can, but without causing pain. So find that threshold. So kicking. Let's say I can only give 60% before my knee starts to hurt. I want to back off to 55%. So I'm still getting some like activation. My quad is turned on. My knee is working, but I'm not taking it through like range of motion, which may be aggravating it. So those two exercises are really good for going up and down the stairs, but also all the exercises that I just went over at the end. So doing your squats, finding which squat and deadlift positions like feel good, lunges, glute bridges, clam shells, the sideline leg lifts, and the hip cars. So bringing the hips and legs around. Okay, and then another question that I got earlier was pain like behind the knee. So figuring out what's causing that pain behind the knee. So we have our hamstrings behind the knee, and then we have like our calves that also cross the knee. So a good exercise for people that have pain behind the knee are going to be those glute bridges. And if you guys have sliders or literally like washcloths on a hardwood floor, anything that your heels can slide out, I'm sure that you guys do this because I've definitely done this in here. But raising up into that glute bridge and then pretending that my heels like had sliders, and then it's slowly gonna like slide those out at the same time. And then you can slide them back up, lift your hips and slide out, or you can even just like walk it out. So that's another one for behind the knee pain. And then also doing calf raises. So if you could find a stair and a railing to hold on to, and starting up and then slowly going down on one leg. And I like the step because it gives you a little more range of motion, and then you'll end in that stretch. So that's another way to stretch like that back of the knee. So those two exercises are really good for back of the knee pain. And I think that was it for all the questions. How to deal with one-sided knee pain? Okay, so if this is asking what I think it's asking, I assume that it's asking like if my right knee hurts and my left knee doesn't, as opposed to one side of my knee versus the other side. But if you have one-sided knee pain, all these exercises that I just went over are going to be great. And you can do them on both sides to be preventative on the other side. But hip strengthening is going to be huge. And then strengthening the quads, strengthening the hamstrings, everything basically around the knee and strengthening it is going to help with that knee. I hope that answered your question. I think that's what you were asking. And so if you guys missed it or you wanted to rewatch it or recap it, you can still access this on YouTube and Facebook after you guys are done. And so I just want to say thank you guys for hopping on. This has been awesome. And if you feel like this resonated with you or you want a little bit more guidance, or you have been dealing with some like chronic knee pain, you can reach out to me. I'm happy to help. You can either friend me on Facebook. You can send me a DM. I love talking to people. And we can hop on the phone. We can have a chat, see if we're a good fit for each other. As far as what I'm doing now, I'm doing some like FaceTime visits with my patients, or I'm just programming weekly for my patients that I have, and then they're going off. They have like the app and they can see everything that they're supposed to do. And that's been working really well for people. So if you guys, I know we're in different locations, but you want to reach out to me and that's something awesome, I'm happy to do that. My Instagram, if you want to follow my handle, is bridgethegap_DPT. Or if you want to email me, it's christine.sweezy@yahoo.com. And I think that's all I have. So thanks again for hopping on, and I'll talk to you guys soon.
Got one more.
Okay, one more.
If the tendon on the outside of the knee is sore all the time, what is the best way to address this? Tendon on the outside of the knee.
Okay. If something is sore on the outside of the knee, biggest thing is I would try to deload whatever you're doing. So if you need a week or whatever to rest, to see if it'll go back to a baseline of not being sore. And then we slowly need to start working on hip strengthening or posterior chain strengthening and finding things that feel okay, that don't aggravate it. That's like where we're going to try to start. So trying to find out the things that flare it up and the things that feel good. So you know that you can do the things that feel good while still strengthening. And then we can start to figure out those triggers that tend to start to aggravate you. So the more that you can like realize those pieces, the better then you can navigate that knee pain. I think that's it. Okay. Thanks guys. Talk to you soon.